Hi guys, Dr. Sammy here with the Eastwood Animal Clinic, and we're going to talk a little bit about suturing. And I have Chomp Chomp here, my little boy's cuddle buddy, and he has been used and abused a little bit. So I figured I would take this opportunity to show you all some couple different suture patterns and multitask and fix Chomp Chomp for the little boys. All right guys, so there's a couple different ways. So there's hemostats and needle holders. They're a little bit different. Hemostats are kind of like these, but they only have kind of the grips and the bite. We call them alligator jaws sometimes, a lot of different names for it, and that's all they do is they're for grabbing and kind of crushing and holding suture, holding a vessel while you tie it, doing different things like that. These are needle holders. There's a couple different versions. The human side, they don't tend to use the ones with the cutting edge. They tend to pull it up and they have an assistant cut it for them. Doctor's preference. Most veterinarians use this type. I believe they're called Holstad hemostats, if I recall. And what they are is they have a little grip there, and then that part is cutting. So you don't need that assistant because you can cut it yourself right there. And then it's just a lot of hand-eye coordination, and your hands get used to going through certain suture movements and patterns and that kind of thing. So practice makes perfect and makes more comfortable. There's a couple different ways to hold these. You don't just grab it like that. That doesn't work very well because you can't. This is not realistic to do in surgery. You need to be able to operate this whole thing with one hand. Kind of like if you were cutting paper for wrapping presents or Christmas time. You don't want to use two hands to cut scissors and cut the paper. You want to use one hand in one motion and kind of go through it. So one way of holding it is you use your ring finger, this one, not this one, none of y'all be funny, and you put it through one side if you're right-handed, and then you can put your thumb through, and I put my pointer finger on there for more support, and you kind of can manipulate it and turn and go through that way. Another way where some doctors like it, once again, that ring finger goes through the hole, and you can use that little, kind of where the bone or that tissue on your thumb is, and you can open and close like that. And it's just doctor's preference. So you can do that, or you can do that. The advantage with doing this one is you don't get a callus and a sore on your finger from doing chronic surgery and suturing. Over time, you do get a little callus just because of chronic rubbing. This, you don't really get it because it's not making a callus, but still works, just doctor's preference. A lot of different ways to do many things. So first we're going to start with a very simple one called a simple interrupted. And usually you'll kind of grab about 3/4 of the way. Half doesn't usually work real well. I usually go about 3/4 of the way on the needle. I don't have thumb forceps on me at the moment, so bear with me on that. Usually I'll have the patient tied up and they're facing so I can get to it. But you want to do a smooth motion, kind of curved. That's why you have a curved needle, not a straight needle. It's designed for that motion, not this. This doesn't work very well, but you want to do that. Other things you all can use to practice at home, because I'm thinking about it, banana skin, banana peels are really good for practicing suturing. Just make a little cut in it and then practice suture closure. Oranges don't work too well, but you can do it. If you want to be real fancy, you can actually order little suture practice kits and they give you artificial skin like things to work on. Banana's cheaper, so that's an option. So once again, kind of have your tissue. I tend to get about 1 or 2 millimeters back from the edge and then rotate through, make that curve, and then grab again and do the same on the other side. So you go through both sides at equal distance as best you can and pull it through, and then I lay them down in the middle, make one loop and reach across and pull. Lay it down in the middle, make your loop, turn, grab that end and do that. You want to do that at least 3 to 5 times, and that'll typically make a pretty good simple interrupted knot. Surgically, I usually reach down and hold it myself and then come back and do that. If you have an assistant, it's very nice, but I don't always have an assistant because they're busy doing things, but sometimes I have extra help and it's nice to have when I'm doing bigger, more difficult surgeries. So once again, Usually I'd be using forceps, I just forgot to grab those. Go through, do that circular motion, then grab the other side, equal distance, circular motion, pull through, grab, and then I go around I'm right-handed, so on my left one I use 2 fingers to pull it through till about where I want, and then I pull and hold. I lay it in the middle, make 1 loop, go across. There are some where you can do two loops, like 1, 2 on the first throw, and that just prevents the knot from coming out a little bit. Makes it harder for the knot to slip. We use them in different areas, certain techniques for in the skin, certain techniques when we're closing vessels, a lot of different ways to do things. So once again, put minimum 3 to 5 throws, and then you can cut. So that is a simple interrupted. The next one is going to be what's called a cruciate pattern. So cruciate as in an X, think of it as the cruciate ligaments in the knees. For those of you who are vet students or medically oriented, you have a cranial cruciate and a caudal cruciate inside the stifle or the knee, and they make an X. They're called the cruciate ligaments. Well, we're basically doing a cruciate suture pattern. So once again, equal distance, go through, and then the opposite side, there you go. And instead of making my knot after the first throw, we're going to go through, do a second one right next to it. You'll figure out as you play with it what looks good when you close skin and that kind of thing for the distance. Typically I probably do about 5 millimeters, half a centimeter. That tends to work fairly well. Get the right closure that I'm looking for and not too bunched or too loose. Then, once again, place it in the middle, make a loop. In this case, I'll do 2 because we just talked about doing 2 throws, and do that. Pull it snug, and again. And lay it in the middle, go over, and then pull across. If you can, try and pull that suture in your hand directly across from where you're pulling. That helps make the knot a little bit tighter and a little bit cleaner. It's a minor detail, but it does make a little bit of a difference. So that, don't just pull it like this. That doesn't work, make a pretty knot. You want to pull it directly across your incision. So that is a cruciate. We'll extrapolate a little bit on what's called a simple continuous. So what that means is we're going to go through and we're going to make our initial knot, and then we will continue that suture without cutting it, and we will make a line, basically, is what we will do. All right, once again, get your couple throws. There you go. You can cut that little tag. That's nice, makes it look prettier. And then you simply kind of grab, do the same concept, just we're not making a knot, okay? Once again, I just forgot my forceps, but that's okay. Once again, about 5 millimeters apart, go through the skin at equal distance, pull through or whatever you're trying to close, and you keep going. I tend to pull it a little bit along the way, makes it a little bit more snug. But if you don't, you can go back through and lift up on those little loops. And I'll try and show you that here on the next couple. To make it tighter in case you have it too loose once you get to the end. Sometimes that happens and you don't want, you know, if you're closing something that has a lumen, a couple different techniques to use for that, but like a bladder, a stomach, a small intestinal loop, you really don't want those contents, aka urine or GI contents, leaking out into the abdomen. That tends to cause a problem. Okay, so there we go. We did our simple continuous. This side is nice and tight. See how loose these are right there? That's gonna leak if we try and leave that, and that's gonna cause a problem for us. So you can use thumb forceps if you have them. I tend to use either one, kind of depends. And just go through, pick up on that loop towards the side, and it'll make those tighter. And then once you get to your knot side and get it closer, I can cinch it back up, and there we go. Once you get to the end and you're happy with where it's at, you basically just do the same thing, and this time we're gonna tie it. But now you have this nice little fun little loop there. So you can grab it basically. Pretend that's your free end. It's just in this case, a loop. So I lay it in the middle, go around, maybe twice if we're trying to do that. Pull, make sure it's tight, pull straight across, and make it snug. Make my second loop, boom, second knot, third knot. Oh, left a little bit there. How do you get rid of it? Pull the tail ends, and eventually I'll grab that and tug on the right one, and you get it. So there's some basic suturing for you guys. And ta-da! That hole's all gone. All right, guys, hopefully that was helpful for you and some little basic introduction to suturing. And hopefully that was useful for you guys. And we'll see you around. See you next time. Bye.